I'm Catherine Poole, President and founder of the Melanoma International Foundation. A long time ago, I was diagnosed with melanoma, and I had nowhere to turn. I had no other patients to speak with. I only had my doctor to rely on. And I found navigating many patients daily that they really need to hear from other melanoma patients and their experiences and what helped them cope and find the best direction for their treatment. We hope that you will never have to travel this path alone.
I had a mole on my back that had been bothering me. I'd asked my regular doctor about it, who said it was nothing. Went into a dermatologist when it started to grow, who said it was nothing, and said in 2 weeks I would get something in the mail saying that it was nothing. And she called me about 6 days later saying it was melanoma.
I was diagnosed 24 years ago. At the time of my diagnosis, I was a new mother with a 5-month-old baby. It was very scary to face a diagnosis of cancer when I was just getting ready to enjoy my life as a mother.
My first diagnosis was when I was 25. I had a mole removed, and it was found to be melanoma, and luckily it was stage 1, it was removed, and for 12 years after that, I kept wearing long sleeve shirts, put on sunscreen, and had my bucket hat wherever I went. In August of 2012, a month after my son was born, I went to the hospital with what I thought was a spiking fever and left 16 days later with 5 confirmed tumors.
Yeah, I went from meeting with a doctor where the joke was that I had been there, once a year for 10 years, more frequently earlier, and the running joke was that I was just there to pay my copay, to sitting down and having a quite serious conversation, and things go through your head, things that would go through anybody's head. How long do I have to live? Do I need to stop working?
The primary tumor was on my left leg. They took it out, did a wide excision and a sentinel lymph node biopsy, and then that was that. Over the course of the next year, I started getting infections in my surgical site, and the surgeon kept saying, oh, it's nothing, it's not related to melanoma. And then finally, after the 4th infection, the oncologist who was following me forced an appointment at my surgeon's office, and he said, okay, we'll go back in, we probably left a suture behind, is causing infections. So they went back in and they took out a mass and found that there was melanoma there. So at that point I was stage 3. They decided just to wait and see, and I had clear scans at that point, so everything was good. The next month I got pregnant with our son, and so we didn't do anything for a while, obviously, for the pregnancy. And then the week before I was supposed to return to work from maternity leave, my doctor said, hey, let's do a follow-up scan since it's been a while, just to make sure we're clear. And that scan showed melanoma in my pancreas and my liver. When the biopsy showed melanoma, the first thing that went through my mind was, I have an 11-week-old son, I can't have cancer. I just brought a new baby into the world. I have to be there for him. Certainly picking treatment is very overwhelming because the key to deciding for me was to make sure that I was doing things in what I could determine to be the best order. We did a lot of research and we spoke to a lot of people and we gathered as many opinions as we could before we made any decisions.
When I became stage 4, I knew that I was going to, in effect, make it, a part-time job or a hobby to become educated in terms of what the treatment options were.
There's just so much out there to read about, and you're always reading about people that are doing well on something new, and sadly, you still read about people that passed from melanoma, but I don't seem to see that as much as I used to see.
You have to keep reading and keep digging and to try to achieve, that basic level of understanding so that you can at least have intelligent conversations, with your doctors and others to make treatment decisions.
I think the only treatment was chemotherapy. I did look at clinical trials first, and then I did chemotherapy later. After my girl was born, I was diagnosed again with a recurrence. The melanoma came back in my lung, I became stage 4. I had surgery to remove half of my lung to treat the melanoma. It came back in my spine, so I had additional surgeries. Came back into my brain, so I had radiation, like a cyber knife treatment to treat 2 small tumors in my brain. And a few months later, it came back in my small bowels. So I had 2 surgeries to remove tumors in my small bowels. The treatment that was most effective was the surgeries.
We said, we don't want the treatment that's going to give me a few more months or even a few more years. The young family, that's not what I wanted. And I wasn't going to sit there and settle for, make the best of the time you have left when we knew that somewhere there was treatments that were going to give long-term progression-free disease.
My family and friends suggested some things but didn't really know about melanoma, and so usually the things that they suggested were standard treatments.
When I first went to see the melanoma specialist, we talked about what was at the time the frontline chemotherapy for treatment. And we talked about how there's a pretty low incidence of success, and there's almost an equal incidence of people that don't survive it. I think right in that meeting we decided that we would go for the treatment. Check into the hospital for a week, come back out and rest for a week, check back into the hospital for a week, and then wait for 3 weeks for scans and then find out that it didn't work for you. And that was my first real disappointment. What do I do now? Because you've just told me that you've given me what's available so far other than trials. And so we talked about trials. The initial treatment that I had was interleukin-2. That did not work for me. But then the trial that I got into was the BRAF enzyme inhibitor. Probably within 2 or 3 weeks, my symptoms were greatly diminished. I was hardly able to breathe at the time. I couldn't talk without losing my voice. I'd have to, 3 words out and I'd have to stop and catch my breath. 2 or 3 weeks after starting the medicine, the BRAF, I carried on a normal conversation.
You have to be responsible for finding out what is available to you. The research for melanoma is changing so drastically and so quickly, which is a wonderful thing.
Perhaps you're geographically situated where you can't get to a melanoma specialist. But if you go to see a local oncologist and you know about different treatments and you know about what's available out there, you can second guess what you're being told. You can understand how it's being explained to you.
You need to speak with specialists, you need to gather as much information as you can, and you need to be proactive about making a decision. You cannot rest and take one person's advice.
The oncologist I have now is the 3rd one I met with, and it was really because I needed to find somebody that would work with me and give me options and listen to what I had to say and how I was feeling.
Follow your instincts, because I think usually we know what's good for us.
You know your body better than anybody else, and that's important to keep in mind. And sometimes you have to guide the medical team to make decisions that are right for you.
Doctors work for you. They are very smart people, and many of them are saving lives. But make sure that you are okay with the decision you make, because it ultimately will be your life on the line. So if you don't feel comfortable or you are not sure if this is the best option, take the time to get a second opinion. Do your homework. Reach out to an organization like Melanoma International that will help guide you through the decision-making process and leave you with, I made the best decision possible as the result.
Find somebody that you can lean on, either for physical support, mental support, technical support. Boy, if you've got some doctors that you can trust and believe in, you've got a leg up there.
It's so important to have strong support. So turning to people that can really be present for you.
I was just so fortunate. I had doctors that I felt very confident with. I had my wife that was always there at my side. Boy, that was just so fortunate having that extra set of ears. You know, my ears didn't pick up everything.
Tell people what you need. Ask for help. Often loved ones don't know what to say. They're not sure how to be supportive. Have people really listen to you.
Some people, they're there for you and they just, listen, or they help you with, what you need.
Certainly turning to groups like the Melanoma International Foundation that supplies a wealth of information.
To me, it's probably as much of a stress release sitting and reading the Melanoma International Foundation forum as what used to be sitting and reading about, who the Eagles might draft for, the upcoming season.
Melanoma, of course, is a family diagnosis. It's going to disrupt the normal flow of family relationships and family life. How to tell, say, your children becomes of great importance, and often people feel so unprepared to deal with those very difficult conversations.
With my children, we had to talk to them at the different stages. When they were young, we didn't really tell them much. They knew I was sick and I was having treatments. I doubt that they saw me crying too much, so I did try to protect them from, getting too upset.
You find out on day one that you've got this tumor growing inside you, and you are absolutely convinced that this tumor is growing exponentially, and every day that goes by without treatment, it's getting bigger and bigger and bigger, and pretty soon it's going to be too big to treat, and you haven't even gotten in to see that doctor for the first time. So that frustration is tough to deal with.
Distress, fear, anxiety is perfectly normal. Getting a diagnosis such as melanoma can be devastating.
Absolutely felt fearful and anxious. I had a baby, like I said, and my biggest fear was the potential to not be there for him or see him grow up. But, on the other side of that, he was a blessing in the whole thing because I didn't have a choice. I had to live for him. There's no other option.
Going online, blogging, listening to other people's stories can be of enormous help.
I had a binder with stories that I found on the internet of people who had survived several years. They were stage 4 and survived. And I said, I could be that person as well. And actually, I am one of those now, so I feel very, very lucky.
You can get caught up in a whirlwind of medical appointments, research, talking to people about what it is you should do, and that becomes the focus, and it crowds out time.
One of the things we found that was key was to spend some time with each other, spend some time doing things that are for you, for your body. Not just myself, but also my wife, and for our kids, that we take family walks. We have a very active family life, including travel, seeing friends, doing things.
Throughout this journey, what's probably surprised me the most is, some of the things that you get through that you didn't think you could get through before. When they tell you have to have surgery and different things, you think, I can't go through that. You're stronger than you think you are.
I did have a strength that I didn't know I had. Of course, it's not what you want to do, but you go through it and you come out of the experience being a much stronger person.
I think what has surprised me along the way is how much beauty is in this journey. The love that you experience, that you feel and that is given to you is, it's like nothing anywhere else.
What I do, or I try to do as much as possible, is always to believe that success is possible. There's somebody out there that is getting success, and why not me? Or why not you?